Hey, are you RT?
Hi, yes, I am.
Hi, I'm Robin. I'm a level 1 nursing student, and I was
Hi,
just
Robin.
wondering if I could shadow you today.
Sure.
Okay, it looks like you're working on a patient right now. Can you give me S-bar?
I am, and I can.
Sure.
Just about to go in and see Miss O'Connor. She's a 34-year-old female. She was admitted to the ER this morning, about 2 hours ago.
Okay.
She is coming in because she was complaining of fever, chills, general achiness, malaise. So she came in. She's 177 pounds, 5'9". She is a full code. She does have an allergy listed to trimethoprim, sulfamethoxazole.
That sounds difficult to say.
But we're going to double check that with her when we go in there. She apparently gets a rash from that. She had an x-ray this morning, but that came back, the doctor said didn't see anything abnormal. She does have a blood culture pending and is waiting a urine catch also.
Okay.
So we'll talk to her about that when we go in. She is on dialysis because she does have end-stage renal disease. And she does, which she was diagnosed with a year ago. She also has diabetes type 1, and she's had that since she was 8 years old. Okay, she does also have hypertension, and because of the diabetes, she does have some retinopathy, which is her vision, and neuropathy of her lower extremities.
Okay.
So she does have some mild sweating right now, and she also has a history of UTIs, and she has an AV graft in her left arm. And she got that 11 months ago. She does have a thrill and bruit present there, and she did have an infection to that 3 months ago. So we're going to go ahead and assess that as well. She has a productive cough, but she denies shortness of breath. Her lung sounds are clear, but she is a former smoker. She quit 2 years ago.
Good for her.
Yes. So she denies chest pain or palpitations. Her pulse is a little weak. She is tachycardic, and her heart rate is 95.
Oh, wow.
And she does have a temperature. Her temperature is 101.1. So, and her respirations are a little high, about 20. But that could be an indication of infection going on.
Right.
Okay. So she does have slight non-pitting edema in her lower extremities too. Everything else looks good. Her abdomen is soft and tender. She does have some difficulty voiding. She's also on input-output as well. She's set up for going to dialysis this afternoon.
Okay.
So we're going to go in and get her started on some antibiotics.
All right.
And some normal saline. That can, it's a broad spectrum.
Okay.
So it's going to attack any bacteremia that she might have, or if she has a UTI, which looks like might be possible because her white blood cells.
So that's why we're giving her that? Just because she has all those indicators of an infection, so we're going to try to, knock it out super
Correct.
efficiently?
Yeah, because her white blood cell count is high. So it's 12,400, so that's above the threshold that we like to see.
You said it was a broad spectrum antibiotic?
It is
right?
a broad spectrum.
So what action does that have on the body then? How does the broad spectrum work?
Well, it attacks most gram-positive and negative bacteria in the body. Imipenem, which is what we're giving her, binds to the bacterial cell wall. Okay, so that causes the cell to die, and then it can't reproduce.
Cool.
So that's the point of that. We're also giving her IV cilastatin, which is with the imipenem, and that prevents the kidneys from inactivating the antibiotic. So we want to keep it in circulation to help kill the bacteria.
Okay. And then when you're giving that medication, when should you really question giving it?
We would question it if, of course, if her blood cell count is within normal limits. If we're not seeing any signs or symptoms of infection.
So she doesn't have a fever or anything?
Correct.
Okay.
Correct, yeah.
And does the medication have a therapeutic serum level? I think they talked about that in level 1 a little bit.
Yeah, actually for imipenem, there's really no definitive for the serum levels. It should be between 1.56 micrograms per milliliter and 58.8, but there's stuff out there that says it could be different than that.
Right.
So.
Okay. And then I know you just talked about the vital signs to monitor, but can you remind me one more time which ones we're going to be looking at for these?
Yes. Yeah. We'll be looking at her, of course, all her vital signs. Make sure they're in normal limits. Of course, her heart rate, because tachycardia can be a sign of infection, as can her temperature.
Right.
So we're going to look at those specifically.
Okay. And then as far as like physiological parameters are concerned, and anything apart from the vital signs that we're going to want to look at as well with her?
Well, because she does have some mild sweating, we're going to look at that because that can be a sign of fever as well. So we'll look at that. And we'll look at her. Right now she's alert and oriented times 4. So we'll of course look for cognitive signs. That could, in severe states, be a sign of sepsis.
Okay.
We want to avoid that.
Yeah,
so,
definitely.
So any confusion, we're going to definitely question.
Okay. And then what interventions do we need to teach the client to ensure that the medication is administered safely in the hospital setting?
Yeah. Well, in the hospital setting, of course, we're going to want to make sure that they are aware and educated about the medication that they're receiving. That way they can question it. If somebody comes in and tries to give them a medication that they're unaware of, they can be another safety measure for us. Of course, we're going to use the rights of administration, right route, right dose, right time, right medication, right order, and of course the patient always has the right to refuse.
Of course,
too,
yes.
So.
And then as far as taking these medications at home, how is it the same stuff that we're teaching them, or?
Well, they're really not going to be getting administered IV medications at home.
Okay.
At least for her. So that really wouldn't have any effect. Of course, when she's at home, she would want to look for the signs and symptoms of infection, such as her elevated temperature, general malaise, tachycardia, whatnot.
Okay. And then for the medications that we're giving today, what side effects might she have, and what are the potential adverse reactions?
Well, we're going to look at of course, the most pertinent side effects that go along with the administration of imipenem. Anaphylaxis being the most severe. That would be a systemic allergic reaction. So, and that's
it's bad.
Big emergency. So we're going to watch out for that. Also, it could cause some irritation at the infusion site. So we're going to look at the infusion site, make sure there's no swelling, tenderness, possible infiltration at that site. In rare cases, it can also cause seizures, superinfection, which is not good.
No, not at all.
C. diff and hypotension.
Oh, fun.
So we're going to look at her blood pressure as well.
And then how do we know if the medication is effective?
Well, she's getting regular lab work done. So we're going to look at her white blood cell count again and see if that's dropping down to a more normal level. We're also going to look at her, because of her end-stage renal disease, we're going to look at her BUN levels, which are elevated, of course, and also her AST, ALT, and creatinine levels as well.
Right. So. Okay. That's all the questions I have right now. Do you mind if I watch you give the medication?
Of course not. Let's go in and see Miss O'Connor.
Okay.
Come in. Number 4.
Hi, Miss O'Connor.
Hi.
Hi, my name's Rich. I'll be your nurse today.
Okay.
Do you mind if Robin comes in? She's a level 1 student. She's going to watch me.
Hello.
Oh, that's fine with me.
Okay. Okay, wonderful.
All right, I'll go ahead and shut the door for you guys.
Samantha, how are you feeling today?
I'm feeling okay.
Yeah?
Yeah, a little warm, but
Okay, yeah, it looks like you have a little bit of a fever. So how's your pain level, would you say, right now on a scale of 0 to 10?
right now maybe a 1.
Okay, so that Tylenol I gave you earlier is starting to kick in.
Yeah.
Okay, wonderful. So today we're going to be giving you 2 IV infusions.
Okay.
Okay, one's going to be normal saline. Okay, and then we're also going to be giving you an antibiotic.
Oh, okay.
Okay?
You know that I'm allergic to some antibiotics.
Yes, I see here that you're allergic to sulfurs.
Yes.
Correct? Okay. Is there anything else that you're allergic to?
It's that trimethoprim.
Trimethoprim, sulfamethoxazole?
You got it.
Okay, great. And that gives you a rash, is that?
Yeah.
Okay. So yeah, I checked and made sure that this medication is not doesn't have any problems with that specific allergy.
Okay.
So, and we're not giving you any of the trimethoprim, so it should be okay. So, okay.
So these 2 ones are sterile. You want to make sure that you
Okay. So can you give me your full name?
Sure. It's Shanae O'Connor.
Okay, and your date of birth?
6'5" of 82.
Okay, great.
You need this thing, don't you?
Yes. Just that. Okay. Looks good. And there's your allergy band. Okay. So next we're going to pull up the medications that we're going to be giving her. Okay. She's first of all going to be getting some normal saline. Okay. And the antibiotics are going to infuse as a piggyback into this.
Oh, okay.
Okay. Do you have any questions for me, Miss O'Connor?
No, but you can call me Shanae.
Shanae? Okay.
Well, this might be for the antibiotic.
Okay. So we already made sure we have the right patient, so we're also going to make sure that we have the right medication. Okay, looks like sodium chloride, 30 mils per hour. Okay, and you also want to look at the bag, make sure it's clear. Normal saline should be clear. Okay, also look for the expiration date, and looks good. And there's no leaks in the bag. Okay.
490 milliliters just so we have enough time to change the balance.
Now in class you did learn that this is a sterile procedure, right? I mean, as far as making sure that specific parts of the tubing
It was just
stays
the
sterile.
spiking itself, right?
Correct,
Okay.
yes.
I don't know.
And go ahead and hang this over here. So you know that the piggyback's going to hang higher than the primary infusion.
Yeah.
And that's with gravity. It's going to help infuse the piggyback first.
Yeah, they were saying something about that in lecture.
Yeah. Pull this out. So I like spiking the bags when it's laying down. Okay. So the parts that are going to be sterile are going to be the spike here.
Right.
Okay. And also underneath this blue cap. So we're going to make sure that we keep that sterile as we spike the bag. Okay. Go ahead and hang this. We also make sure that this is tied closed so we don't leak it all over the place.
Yeah, that would be bad.
Okay, so we're going to go ahead and prime the tubing.
Okay.
And get all the air bubbles out of it.
And actually, before I hook you up to this, I would scan it. Your name and date of birth again? Ishmael O'Connor. Okay. And I am.
Well, no, but it's the thing, it's,
Okay. Close that off. Okay, so we want to look at the line.
Mhm.
Make sure we don't have any air bubbles. Okay.
Looks good to me.
Okay, great. Okay. And go ahead and look at our patient's catheter. Okay. Now look, do you have any pain?
No.
Okay, no swelling, no redness.
Mhm.
Okay, looks good. So what we're going to go ahead and do is we're going to go ahead and take a normal saline flush, and you also want to make sure that it says normal saline.
Right.
Okay, and it
You don't want to
looks-
accidentally give them anything else, right?
Correct. 'Cause there's many medications that come and look similar. So we're going to go ahead and clean the site, clean it like you mean it. Heard that, right?
And what's the word for this? It's it starts with a P. They were talking. Miss Morris was telling me about it. You're checking for P something. What was it called? When you're checking the IV site to see if it flushes.
Patency.
Patency.
Yes.
That's what it's
We want to
called.
make sure that there's no obstructions,
Mhm.
and it's going to flow into the patient's veins. We'll make sure it's open. Go ahead and connect that. Okay, I'm going to go ahead and flush. And you have any pain when I do this?
Nope.
Okay. Looks like it's infusing well.
It's a little cold, that feels good.
A little cold? Okay. And go ahead and close that off again. Okay. Okay, so we're good with that. Okay. And go ahead and turn our machine on. Okay.
Makes a loud noise, doesn't
Yes, it is. Okay, now we're going to be doing the normal saline. Let me check one more time to confirm. Okay. 30 milliliters per hour.
Okay.
Okay. And put in 30. Oh, that's... Let's do that. Yep, 30 milliliters per hour.
Mhm.
Okay. And we're going to go ahead and we're doing 1,000, so we'll go ahead and set it at 950. Okay, that way when we come back, it's not fully, there's no air in the line, and it can alert us prior to closing up. So,
Okay.
so we'll go ahead and start that. Okay. Now I'm going to pause that.
And your name and date of birth?
Take the line.
And
Mhm.
the
You see this is still sterile because it has the cap on it.
Right.
And I'll go ahead and clean her site one more time. You can never clean it too many times.
Nope.
And I called that in my order.
Clean that there. Okay, tie it in. Make sure this is open here.
Mhm.
Okay. We're going to make sure that our clamp is open.
Right.
Okay. Otherwise, it'll yell at us.
Aw, that's no good.
Okay, and we're going to start.
Oh, it's green.
It's green, so we're going to also check and make sure you see drops coming out. Take a couple minutes, still checking the line.
And what was the rate you set it to?
30 milliliters per hour.
So we might not get a lot of drip.
Correct. And there's an occlusion. Sometimes it can be just simply over tubing. Okay.
Oh, I see you thinking about it. I see you thinking. We have drops.
And then we have some drops.
Very slowly. Well, 30 milliliters is not a lot.
Correct. It's not going to go very fast. It's good to always at least check for 5 drops. And make sure it's infusing correctly. Okay. So we have the main infusion going.
Okay.
Any pain, discomfort over there?
Nope.
Okay. Okay. So then we go ahead and we always chart after we start a medication with the patient.
Right.
Immediately afterwards.
Alright, I need to start over. Why isn't it going? You should have kept going and just said the hell with it. Yeah, exactly. Like I did. Because you can't see it. A is blue. You gotta hang that lower. I thought you did that after you primed it. No.
And then you hang the tab. Now you're back forward. You open it.
And sometimes these two of you have to unclamp it. That's on the white side. Because they're like an air bubble sometimes.
Okay.
Take it out from the left side.
So now next we're going to go ahead and start up her piggyback infusion.
Okay.
There you go. That's what it says.
Okay.
That's higher and then lower.
Miss O'Connor, still doing okay?
Yeah, I'm alright.
Okay. Date of birth again?
6'5" of 82.
Okay.
There's no way you can like combine the videos together. I mean, there's a way. I don't know. I'm not a computer.
Now we received this medication from the pharmacy, and they already injected 500 milligrams of the imipenem.
Oh, through the special port, right?
Yes, through this special port here. So we want to also check it. It is a little cloudy. It can be yellow sometimes.
Oh.
Okay, so that's to be expected.
So that's normal?
That's normal for this medication. It's 100 milliliters. Okay.
Yeah, we have a lot of
And we're going to be infusing it over 30 minutes.
Okay.
So we also want to make sure that it's the correct medications. It hasn't expired, and the bag is paid.
Right.
And don't forget to use your gloves. Just remember afterwards.
Okay,
Right before
double
you
check
can do
again.
it.
Of course, do our 5 rights as well. We're always using universal precautions.
Of course.
Ensure that we're washing our hands and gloving up. Gloves always don't work for me.
Especially after you use the hand sanitizer or you wash your hands, I always find they stick.
Yeah. So, Ms. O'Connor, with this medication, it's going to help the infection
Okay.
that we see going on with you. You see some elevated white blood cells, which are kind of the protectors in your blood.
Oh,
They
okay.
keep germs away and they kill them. So those are a little high. So those are kind of showing to us that they're fighting some kind of bacterial infection, most likely. Okay, so that's why when you're at home, if you see any signs of a fever, or you're just not feeling well, if you have fast heart rate, then you definitely want to check with contact your doctor.
All right. Sounds good.
Okay. So with this one, we're doing the same thing as we did with the primary. And this is the sterile part here. Make sure that our line is closed. And spike the bag. Go ahead and hang this. Okay. I'm going to do the same thing. I'm going to go ahead and prime the line.
Oh, there we go. This is a brand new secondary.
Make sure there's no air bubbles. Okay.
You should have seen yourself.
So we're going to look. Okay.
Alright, I'm going to delete this video, okay? That way you have more space here.
So this is where we're going to attach it right here.
Okay.
Okay. So we're going to take our alcohol swab.
Hi there, are you Terry?
I'm also going to pause this just temporarily.
Mhm.
If I were you, I would just go like this. Now that you have a big mess here, separate primary from secondary. No, you didn't.
And make sure we clean the site too. Make sure we don't introduce any germs into the line.
Right.
Yeah, go ahead and make sure this is open. Okay. Then we're going to set it up for okay, secondary. There's imipenem, cilastatin right there.
Okay.
Okay. So we're doing 500 milligrams in 100 milliliters.
Mhm.
Okay. That's correct.
How many more weeks you got?
Okay. Okay. And we're doing this over the doctor ordered 20 to 30 minutes. Okay.
Oh, okay.
So if it's 30 minutes and we're doing 100 milliliters,
Mhm.
okay, that should come out to 200 milliliters per hour. Okay.
Mhm.
So go ahead and start that. And as you can see, it's 500 milligrams.
Yep.
Secondary, 200.
Mhm.
And we should start seeing it infusing through.
Yep, I start to see those
Okay.
drops.
And we
There
see
they
the drops
go.
coming in.
Mhm.
Okay.
Cool.
You doing okay there still?
Yeah, I'm all right.
Okay, great. Go ahead and document again.
Whatever. I have to report.
I just got to record that last video. Okay,
I don't even use this for next week.
We're really giving her sodium chloride fluid,
Shannon O'Connor, she's a 34-year-old female. She's in room 231. She's 5'9", 171 pounds. She has allergies to salsa drugs. She's a food code, and Dr. Engelbert is her consultant physician. The patient has been in here for fever, chills, and general malaise. The patient reports of elevated motion, findings, and increased appetite for the past 2 days, and minimal urine output for the last month. She has a history of type 1 diabetes and stage renal disease, and she's been getting dialysis for the past year. She has diabetic neuropathy and proliferative retinopathy.
Okay, so we have that going well. Okay, so do you have any questions for me?
No, I don't think so.
Okay, so again, you know, when you're here or at home, if you have a feeling that you might be getting an infection, you'd want to look for any kind of fever, you know, possibly even diarrhea,
Okay.
elevated heart rate, generally just not feeling well.
Okay.
So if you have any of those signs or symptoms, then go ahead and contact your doctor if you're at home.
Okay.
Okay, and let me know as well if
I
you
will.
have any of those, okay? And if you have any pain at the infusion site or pain in general, let me know, and we'll take care of that for you, okay?
All right. Thank you.
Okay, great. Okay, well, I'll be back shortly to check on you, okay? We have some vital signs coming up for you as well.
All right.
Okay?
therapeutic serum level, both of you can drop.
That was cool. Super exciting stuff.
Any other questions?
Yeah, actually I have a couple, if you
Okay.
don't mind, if you don't have anything else to do right now.
No, I have nothing else to do right now.
So were there any pertinent pieces of information that you reviewed prior to giving the client the medication?
Yes, I was checking her lab values.
Okay.
Specifically the white blood cells. Also wanted to double check because there is you want to use it cautiously with renal impairment for this medication. So wanted to check, and because she does have end-stage renal disease and she is going to dialysis, wanted to make sure and check her BUN levels, liver function tests also, creatinine clearance, glomerular filtration rate, those kind of things to make sure.
Right. And did the information that you found, did that affect your decision to administer the medication?
It did. It did. I wanted to double check and make sure that it was within the normal range as 500 milligrams. She's supposed to get that every 8 hours in 100 milliliters. So I wanted to double check that and make sure that was the correct amount that we should be giving a client for an infection.
Right. And then one more question, if you don't mind.
Sure.
Did the information affect how you gave that particular medication, like after you looked all that stuff up?
It did. It did. Obviously, we went in and we made sure we flushed the line, made sure it was patent. There was no infiltration. There's the site looked clean, dry, and intact. And if it had not been, then we would have held off.
Right.
Because we wouldn't want it to increase.
That would hurt, right?
Yes, yes. So she was not in pain with the site, so we went ahead and gave it per the orders based on the information that we had.
Cool. Well, that's all the questions I have for now. Thanks for letting me watch.
Oh, you're very welcome. And you have some fun and good luck in level 1.
Thanks.
Okay.